watio Ewanu watio nengima Ewanu 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 watio
To show you, we're here with the German Development Corporation, both the financial side and the technical cooperation. So this is the German booth. As you might know, we operate in almost all the counties and we're supporting the Devolution Conference. So glad to have you here.
Yes. Which documents all the natural resources selected?
The fisher folk, to the cooperatives buying for them fishing boats, fishing gears, to support them, both the youth and the women, and supporting them also with the transport to the market. Thank you, sir.
Yes, we have also onions from Bedad.
and there are specific locations, both the industrial minerals and the gemstones. Yes, we've now faceted these. These are value added. We have them in rough stones, then we have the finished product. This is amethyst. It is a purple silica or quartz. It is here.
And also a lot of coal and
yeah, this is the famous coal. Okay.
Okay, what will you keep your rice?
Wow. How nice. Thank you very much, my dear. Blessings. Okay, my name is William. Thank you very much. Asante sana.
Now in my maternal.
Okay, guys, thank you.
Your Excellency, this is the Council of Governors. We have a Marifa Center, the Knowledge Hub, that has documented best practices and stories about devolution. And besides that, we have an open data portal, a GIS gadget, that has data for all the 14 devolved functions, real time, for all the 47 counties. Your Excellency, we want to project the affordable housing, where all the projects are, the status, and the completion date. We have data of all the projects, the water projects in the 47 counties, their status, and all other housing. So you can explain?
Yeah. Thank you very much, Your Excellency. Welcome to the COG Pavilion. This is Marifa Center, a knowledge hub for the Council of Governors. That is GIS based. That means that we can be able to get the exact locations of all the projects and interventions we are doing in the country. So if we come to the affordable housing one, we are partnering with the Affordable Housing Board, so we are able to track the status of all the affordable housing projects. Currently, the ones that are ongoing are 151 projects in the country. The average status of implementation is 24, but we can still go to the individual project and tell you what is the actual percentage of yes. Let's go, for example, to Kirinyaga. Kirinyaga, we have a project of 210 units. Right now it's 97% complete. So, Your Excellency, at the comfort of your office, you can monitor all the projects in affordable housing. The other one that we have is the National Equipment Service Program. This, we're able to tell you the facilities that the counties that are benefiting from this program, the facilities that are benefiting, and the services that are being offered in this program. So, Wajir is there. Yes, Your Excellency. Even in Wajir, they have also set up a GIS system for our chair. They're able to map out all the health facilities in that particular county. Thank you, sir.
We are blessed with that, Your Excellency. Thank you. So, we're doing a lot of work right now. There's some key projects we're looking at, like the work we're doing with KEBSA to ensure that those guarantees go out and the supplier is able to get to the fill order. There's a lot of work we're doing with SHA, Your Excellency, with respect to the IPF to ensure that people can get the funding. Actually, we are working closely with Safaricom. By the end of this week. By the end of this week, they'll have told us about it. Thank you. Yes. Yeah.
Yes, Your Excellency. If I get the commitment within a year, 53,200.
Who has refused with the commitment? Please report them to me.
Thank you very much, sir. Thank you very much, sir. So we have the funding to set up in cluster regional counties. So about
Mombasa told me you are
yes, we did 2 weeks. I'm inviting you to have a groundbreaking, and then we start the work.
And what about Nairobi?
And
Nairobi is our big.
Yes, we are in discussion with them. They have not yet concluded.
Trouble, let me know.
Yes, they are giving me trouble. So yes, they are giving me trouble. They are giving me trouble.
I will take them on.
Look, the funds are ready, the equipment are ready. Yes. This is an African solution to African waste challenge problems. Thank you.
When I was vice chair, I took a delegation of 11 governors to go and see this. And and the value chains around it, the creation of employment, the cleanness of the towns, the local solutions. They get to a point where they sell the end product as fertilizer on the shelves of supermarkets. It really works. That's what it is.
That's good.
Yes. I told him.
Yes, yes. Thank you very much, Excellency.
Karibu. We are standing firmly behind ensuring we are funding the affordable housing program.
Yes.
Here are two beneficiaries. You met them on Madaraka Day in Homa Bay. Amuka na Pamela. They have moved into the Soko Mjinga.
Hello, Mom. How are you? Wewe ndio mwenyekiti wa
Soko Mjinga.
Uko na nyumba hapa?
Nimepata.
Umepata?
Na anakaa ndani.
Na wewe ni mama wa soko? Wa mboga.
Ndio.
Unajua kuna watu wanasema ati nilisahau mama mboga.
Hapana.
Hiyo ni propaganda.
Hata sasa hivi nimemaliza maiza. Kwa sababu nimeenda kwa hiyo nyumba, nimekaa vizuri
kama ofisa.
Nimetandika.
Unakaa kama ofisa.
Nakaa kama ofisa. Hata soko Mjinga tumeanza kujengia.
Sasa itakuwa soko mrefu. Itawacha kwa Mjinga.
Haitakuwa Mjinga tena.
Kuna mwingine alikuwa anasema this lady is the one that was also in Mukuru.
Hapana.
Ni mama wa show tu.
Mimi sijapita hata Homa Bay kuenda huko.
She's the chairman of Soko Mjinga.
Yes. Tena mimi ni mkaaji ya Homa Bay. Nimeshukuru sana President.
Yes, and this is the Homa Bay project. Yes. That we have now fully occupied. It is fully occupied.
What is phase 2?
Phase 2, I think we instructed that there's going to be another 1,000 units to be done. So that
land is, where is the land for that 1,000 units?
Just behind. It was behind the NX.
So let us.
No, the land is there.
Yes, the land is there.
Yes. So what is the plan we need to advertise so that
we advertise and we execute.
Before I leave today, and these are the directions.
Twende Kirinyaga. Sasa huko na Myosa.
We do our cities
Very good.
We also do linen for hospitals online, for doctors, and also for the maternity. Yeah, we do a social program which we are expanding. It's really not that big, but we're managing. Very good. It saves us money, and linen and curtains, everything comes from inside.
Yes.
And then this is you've seen what we have been doing in medical services. We have expanded our facilities. The new hospitals that are coming up, level 4 and 5, they are 80%.
Very good.
In Kimbimbi and Kenyaga, you promised equipment, remember?
Yes.
And we've done about 20
I hope you started
health
working on the
centers.
equipment because you know under that program.
Yes, but even the other ones,
Even
the
the
ones of
other,
70, yeah. This is one of our dairies, Karima Dairies. We support our cooperatives. It's a very small one. We've supported them. The breeds that we have changed to the cow breeds, we've increased the milk production, gave them milk howlers and everything. They are now selling.
Very good.
Rice, you know our rice. And
Very good.
our coffee as well, being amongst the best. Yes.
How are the prices of coffee?
Just we are anticipating to go even higher than
Yeah. So we have our seed propagation center. These are macadamia. So now they propagate different seeds, and one of them is for the new produce programs and they're all connected with the value chain.
The value chain.
Yes. And then the final is our rabbits. You may know that we are the leading ornamental fish producers. Yeah. We're selling, yes, and they are very high demand, especially in the UAE, and they're exported.
Very good.
Now our rabbits produce this urine. This urine is used as fertilizer.
Okay.
Produce fertilizer. So like this is the urine collected last night from this jet. here. So we have to show you.
Light for the world. Yes. This is a project for persons with disability. We normally support them to run their businesses. They're here.
So they make cake?
Yes.
They do
it. She's there, but she cooked it.
Very good. Hello. How are you? Karibu sana.
Thank you very much. Yeah? Asante sana. Thank you. All right. Okay, thank you.
Wajenzi hawa. Hapa nataka majenzi hapa.
I was with these guys yesterday. Hi. How are you, Madam CEO?
Fine, sir. Karibu NYC.
Yes.
This is the youth pavilion of the council.
Yes. Hi, guys. How are you? Very good.
It's been created in partnership with our friends from Safaricom, from ZMCC, and from Ajira. Your Excellency, we are trying to make youth feel at home at Devolution Conference. We have games that you can play. We have the passport that we're displaying here. And we're also saying that we are the generation that can end malaria. In the back there, we're going to be skilling with Ajira. Young people can come here and take a course in the course of the conference. Your Excellency, you'll remember yesterday, you launched Kunaform. In the last 24 hours, we have 4,100 people, young people who have signed up, all below the age of 35. We just for opportunities. Yes, so for jobs, for funding, for skilling, and we will continue to grow the platform and make it useful to all young people.
Very good. Yes. Very good. So, we agreed that the we didn't agree 9. We agreed 100.
To the Senate.
Senate? Very good. Hello, how are you? Very good. This is our
We have no promoters, these are your officers.
Welcome, Your Excellency. We are showcasing the Action Urban Initiative. What we are doing with the community health promoters, we are supporting all the 47 counties to accelerate universal health coverage through digitally empowered, compensated, and kitted community health promoters. So you can see the numbers there, where we have 108,000 CHPs enrolled, and they have been able to register 8.78 million households, and they are currently visiting more than 7.6 million households. And we have done a lot of screening for diabetes, for hypertension, and referred many people who didn't have known that they have these conditions right in their home. So we are actually bringing health to people's homes.
You people are the best.
Thank you so much. Thank you so much, Your Excellency.
I am all in.
All right, Asante.
Congratulations. How are you? Anthony. Habari. Very good. You guys are the best.
Yes.
Thank you. BHA is my place.
Thank you.
Okay. Yes, Mr. Anthony.
Thank you, Excellency. Welcome to our booth. We just want to show you our mandate is really very short. We just want to digitize each and every part of healthcare.
Digitize everywhere.
Every part of healthcare, Your Excellency. We had a plan and we want to show you how far we are. Just in short, we start with SHA. This is my team. And Dr. Amisha will take you through SHA, and then we'll go to Digital Health Agency of the facility and the rest, and my colleague there will take you through. Joyce, please.
Thank you, sir. Your Excellency, at the Digital Health Agency.
It's okay.
At the Digital Health Agency, we believe in data, real-time data for use. So the first stop was the SHA registration dashboard, and as for today, you can see we have already registered 6,152 people. As of now, of course, by evening we'll have reached about 30,000, 34,000, and then approximately half of the Kenyan population is already registered for SHA. And then, Your Excellency, registrations typically are happening at the health facilities. We need to change the Kenyans' mentality about seeking for health care, because you should be registering for insurance when you're happy and healthy. Exactly, but you can see from how we are doing things, our registrations are lowest over the weekends, yet they should be the highest because we have self-registration and even assisted registration with the CHPs. Young people are the majority that are registering, on average about 32 years. Males and females 1-to-1 ratio, so wanawake they are not being hidden behind. So it's important to check that. Then on children, we have our dependents. They are about 8.9 million. We expect a bit more. Yeah, exactly. Yes. Exactly. Yes, sir. Yeah. Yes. Yes.
Because we also find out that when their children are sick in their houses,
they want to add them.
Exactly.
Add them ahead of time.
Exactly. And then under means testing, which is done by the people who are basically not employed, the one for normal check-off. So we have about 6.2 million who have done their means test. Yes. And then we have a county registration where we are monitoring the counties, that's how things are happening at the counties. Mombasa is highest at 67.5%. Homa Bay, where we are, is at about 13%. Sorry. Actually 47. and number 13. Yes. And then we have a dedicated county dashboard for the governors to have a look and see some more information about their counties. Exactly. Yes. Your Excellency. Yes. Then exactly. Then something else that is interesting, Your Excellency, we recently have started one bed, one person, and we are monitoring the bed occupancy. In our currently we have about 137,000 beds, normal beds, and our occupancy is at about 50%, so 49.93, and we can be able to see ICU beds and even HDU beds. Your Excellency, if COVID happened today, we would be able to monitor things that we were using an Excel sheet then to monitor, now digitized. So this is, we are on a great journey, and we really appreciate your support. Thank you.
Sorry. Tell me about the identification. We're still using IDs.
Yes.
In our facilities in level 2, 3.
Yes.
Some 4. So what is the plan?
So Your Excellency, we went live for the biometric identification for all our level 4 and level 5 and 6 facilities, which are now using biometrics to do.
How many hospitals are those?
1,094. And we are just now ensuring that, because we still have some small challenges of small failures, we are now tightening that system. Then the second is we are rolling out in every level 3 and level 2. So that we expect that in the next 1 month or so, we shouldn't have anybody using OTP, unless you have a condition whereby you are not able to. Yes, you have a the problem, and we have created a process that must be approved for you to be properly identified. But Your Excellency, I will take you through the highway now. You remember we had the five key pillars. Before I give my colleagues, one was enabling environment. You gave us a law, so all this is now also anchored in the law, so that we ensure that everybody uses the digital system in providing of services. The next was the ICT infrastructure, and in terms of ICT infrastructure, we are assisting every public hospital, every public health worker. We are giving them a device. So far we have distributed 15,000. We are supposed to do 74,000. We have the devices in place, Your Excellency, but we don't want to give devices without training. So it's moving with the speed of training, and that is how we are implementing that. Our health information exchange, I will give my colleagues to take you through. This is also live. We have been able now to actualize this from being a plan to a reality.
Thank you, Your Excellency. My name is Dr. Jeremiah Mumo. This was actually a PowerPoint thing, but we have actualized it from now. It's no longer a PowerPoint, and the reason is is live, Your Excellency, is that at any given time, if it's patient portal, when you click, it will automatically open to you our Afya Yangu, and our clients will be able to move to that. Again, we have also actualized our point of care system as the Taifa care systems, which are used in all our facilities, and we expect with this to be able to all the clients to see, even at governance levels, at any level, to see how many clients will be coming, because we have an interactive dashboard to see what is happening, registration. You can see the queues who have been waiting and triage, who are waiting at consultation at the comfort of the office. You can also see the number of patients who have been admitted, and again you can as well see the procedures which have been undertaken in the hospitals. This goes up to the reports, and again to specific diagnostic areas, Your Excellency. Again, we have also managed to able to share information. What we have been talking about, if you are in Mombasa and you come to Kisumu, you can get your records. Initially was a story. We have actualized, Your Excellency, through what you call the shared health records. So with this, you'll be able to navigate yes, Your Excellency. Yes, Your Excellency.
Double charging, because hospital will charge you for X-ray. Then you go to the next hospital, they don't want to use the X-ray of the other hospital. But now, once you take your X-ray, maybe you took yesterday, you go to the next hospital, your data is there, they should treat you.
They just download it and they see whatever it is.
Yes. And we can monitor this, Your Excellency, real time. Like now, this is what is happening across the country. For the last 1 hour, you'll be able to tell what is happening in terms of, for the last 1 hour 10, we had already 20,000. People being seen either through observation, diagnostic, or prescription of drugs across the country. And this information can be relayed from one facility to another across the country. Your Excellency, also, we are also able to monitor our doctors and our healthcare workers through the health worker registry, which was again a dream. And with this, we are able to know the numbers, what is happening in terms of doctors, and want to make it reality so that even Kenyans can know how many doctors we have, how many nurses we have in the country, and all different cadres we have in the country. So now this is a reality. And again, we have an application which we call the Know Your Practitioner. And again, we have now what we call Practice 360 to enable the doctors to do prioritization within a radius of 1 kilometer.
We localize.
Yes, Your Excellency.
We GPS localize.
Yes, Your Excellency.
You have already geofence and geotag every facility. You can't approve outside 1 kilometer, which is within that radius of your facility.
Yes.
And we keep making it tight, because we realize that some health workers are in very far distances and they are doing approvals, which means actually they are not undertaking some of those services.
Your Excellency, on that one, I think there is data that will really help us on training of doctors.
Yes.
Because if you can get the gaps,
yes,
and then national government takes it, they'll be able to know who should be trained. For
yes,
example, when you break it down to oncologists.
Yes.
I think, like, I don't see the gaps there.
Yes.
But we should, this data now is useful for us to be able to deliver help in a very, comprehensive way and effective, because we will know what the gaps are and all the other things. Yes. I think we can assist America. I saw.
Probably even we're doing the same right now.
But data protection is a big problem. So I saw President Trump struggling. I think we can send some experts. And Ambassador here says also the
Thank you so much.
Thank you guys. You guys are doing a great job. I had a few fellows every night. Thank you. Thank you. Okay, my friend.
This is on digital.
I love that.
This is really data general practitioners, especially in the pharmacies, what it says about radiological, so that you make non-negative pictures of the same but you can use it 3 times, 4 times.
Hello guys, how are you?
Integrated digital solutions for county revenue collections, their HR management, and all the other county services that they provide. We provide a digital dashboard where the governors and the decision makers can actually see real time what's happening in the county.
Okay. So are you working with some counties already?
This is Homa Bay, actually. They are the ones who've really worked with us in tightening the system. That's why our revenues 700, 800%.
Very good.
And now we have incorporated artificial intelligence into the system.
Yes.
So now the system can actually detect where the problems are, leakages maybe, can predict what the future revenue is going to be, what we can do to improve the... Yes, sir.
Yeah.
We actually can talk to it.
How much have we collected today?
Right now,
So just like... How much have you collected today? Of course. So for today, we've collected about KES 125,300.
We can even speak Swahili. Thank you.
One of the requests we have.
Thank you, guys.
This Water Resource Authority, we have, these are the equipment that we use now for water, groundwater monitoring. It's a very modern equipment. Nowadays we have minimized now what we call dry boreholes. For example, this one is called magnetic. It can go up to 600 meters.
Down?
Down, yes.
Okay, to know where there is...
Yes, you can see now this gap here. This is the area where the water is.
Oh.
These are rocks.
Okay.
The blue is here.
So you know where to drill?
Yes.
Okay.
Yeah, we have minimized.
So we stop the guesswork?
Yes, we have also seismic method where we can send a signal to the ground. This one, yes. It can go up to 2,000, 3,000 kilometers.
You sort out that small problem with the tariff?
Yes, the regulation is ready. We are implementing, yeah. Yes.
Very good.
Yeah, thank you, sir. Sir.
Thank you. Thank you.
Okay. 11 bus.
Your Excellency, you have seen a lot of exhibitions on the other side with the community health workers telling you, SHA telling you. I think here is the story of what has been done. Today we are celebrating 96 days of female maternal death. But because of this integration from community to being able to deliver blood, to being able to do trainings, we have the MPPSR.
Thank you, Your Excellency. So, as Her Excellency the Governor said previously, we were losing so many mothers. What we have done differently is we know where every single mother who is pregnant is in Homa Bay right now through our CHPs. As you can see, they walk around with their gadgets. We are able to tell their blood pressure, so we can know what problem they have. They are able to do blood glucose testing and so on and so forth. So, Your Excellency, distinctly, every Tuesday morning at 7 a.m., we have a national meeting chaired by ourselves, and Her Excellency the Governor personally attends, including DG Amoth, PS Oluga and the others, and we discuss every single maternal mortality that we have or a near miss. And through that, Your Excellency, we have managed to achieve 96 days of zero maternal deaths in Homa Bay County. And significantly, Your Excellency, what used to kill mothers before in Homa Bay was obstetric hemorrhage, bleeding a lot before, during or after birth. And as you can see, we have put measures in place, and right now it is no longer the #1 killer of mothers in Homa Bay. Thank you.
Yes, that's the effect of the interventions that we have made there, including working with Zipline to deliver blood and other essentials to the far places. Your Excellency, we have value chains here in Homa Bay, and we've been growing the value chains. Just move a bit, Adele. So if you look at sweet potatoes, we are the highest producers of sweet potatoes. We moved from about 169 tons to 173 tons, 78 tons. For cotton, we moved from planting 1,800 hectares, planting 5,200 hectares. And the most important thing there is the value, because you know the price has moved from 52 to 72. So the value has gone much higher. Sunflower, we moved from only 125 hectares to over 1,050 hectares, and the value. Excellent.
Very good. Thank you very much.
Yes, this is the new
Welcome to the proposed Homa Bay City. This 3D model is transformed from the plan of the city. We want to transform Homa Bay municipality into a resilient and inclusive city. And so we have key flagship projects, one of which is to relocate the sewer system, which is currently at the lakefront. We want to relocate it to another location that we have provided in our proposed plan. Also, Your Excellency, this side we have informal settlements called Shauriako and Sofia. Through BETA, we want to transform it through social housing to accommodate the informal dwellers. Thank you, Your Excellency.
Thank you very much. That's a vision. That's Kabunde, and that's the new headquarters that we had this morning. Excellency. FAO are our great partners, Your Excellency.
Welcome, Excellency. This is FAO stand. Thanks when you met our DG last week in Ethiopia. So here we are working to support the government in 4 major areas. On the area of land, digital land governance, 3 areas, 20 million euros supported by the EU government. We are supporting the alternative justice system. Excellency, in Narok, in Kajiado, there is a lady whose 100 acres of land was not able to get out of court. Alternative justice system supported by FAO, they are now okay and they are using their land. We just launched a $40 million project on youth employment in ASAL areas. This was launched by CS Beatrice School in Turkana last week. So we're going to give a lot of employment to the youth.
Thank you very much. Good to see you.
Hi, Miss. How are you? How are you? Yes. So, you know, you brought me up in the farm. Every Easter, every Christmas, we used to go to Shago and this is the work that has come from it. We are working with traditional beekeepers so that we can move from here until here. We're also working with young people in agriculture, and we've planted 754,000 trees as young people so far to contribute to the 15 billion tree campaign. Thank you for your mentorship.
Karibu sana Mheshimiwa Rais wa Jamhuri ya Kenya. Tumkaribishe kwa makofi. Welcome Your Excellency. Karibu sana Mheshimiwa Rais to Devolution Conference 2025 held in the great Homa Bay County. Karibu sana Mheshimiwa Rais. We shall remain standing as we will start with the two anthems, starting with the Kenyan national anthem, followed by the East African anthem. The anthem. Tukiwa tungali tumesimama kwa heshima, Mheshimiwa Rais, naomba nimwalike Ali Abdullahi Hachi na Reverend Kennedy Zangu watu